Okay, just talking about the future of robotic surgeries and the advantages for surgeons working with them. Dr. Mayturn is sharing more about the robots at Intermountain Health in this sponsored interview. And Doctor, I think that when we hear robots, we're thinking, are the robots the ones performing the surgery? No, it's the surgeon guiding this machine.
Correct. Yeah, it's robotic assisted surgery. So the surgeon's actually doing it, the robot's just facilitating it.
So don't worry, they're still in complete control. I was asking you about all of this that we're seeing on the monitor, because typically the surgeon's over there and then you got the team around, and what is it that they're seeing and assisting with here?
So on the vision tower, they're able to see the same things that I'm seeing, except not in a 3D view like we have from the console, but they can see what's happening. They can be prepared and know which step is coming next. It also lets them see what instruments are in there, and we can pick up on different things that are happening with the robot, and the team can all see that.
Yeah, and while robots are not new, it's just incredible what they can do now. So we're going to give you this sneak peek. All right, take a seat and talk me through what we're going to be doing and how this all comes together on your end.
Okay. So you come in, and I have a 3D view here from my console, and then what I do is I put my hands into the instrument controls here, and then once I do that, I'm able to start manipulating. As you can see, just like you would use your normal hands if you were operating in an open procedure, you do the same thing. And you can move the camera around. You can also move the instruments to get it more comfortable for you. And just like open surgery, we do it, everything exact same way. It's just done with robotic assistance. And so here you can see I'm throwing a stitch here, and we'll tie a little knot in it.
This is truly incredible. Nobody gets to see this. We don't get this behind the scenes access this way. And look how easy, how precise that is. And just tied it in a knot. And you said it's the thumb and the index finger that are in there to manipulate, to control. Wow. Okay, I've got to give it a try. Should we trade spots?
Yeah,
okay.
Absolutely.
Let's do it. So what do I need to know?
So,
coming over, we'll trade.
So jump in there, slide in, and get your head into the console so it activates, and then thumb and middle finger in the grips, and then you can move around. You can try and throw a stitch there if you would like.
Interesting. So you just start squeezing the fingers together, and you can see how it just starts moving, just exactly as you would move your own fingers, your own hands.
And one interesting thing that we have now on the robot is there's something called force feedback, where it lets you kind of feel the tension. So if you take that and kind of pull on it, you'll feel it kind of push back against you as you pull harder. And that's to tell you that you're putting plenty of tension on the tissue or on the knot so that you don't break it or cause tissue damage. And if you're interested, you can grab that rubber band to your left there, and you can pull on it, and you'll get a better feel of that force feedback that we have. So it's some haptic feedback that we're getting on the robots now.
It's amazing that you can feel the tension. Totally. Is that what training is like when somebody's using this for the first time?
Yeah, and there's training modules where you can practice on things before you practice on patients, do little drills, but really this force feedback's nice because it helps decrease tissue trauma, it helps you not break suture, and for residents and people that are in training, I think it helps you be able to be safer while you're on the robot.
I think that you being here today and giving us this behind the scenes and even hopping on to try, hopefully people will have such a peace of mind with what technology can do and how natural that feels.
Yeah.
Wow, it's so intimidating walking in and seeing this setup, but then hopping on and feeling it, it just seems like this is the way.
Yeah.
So easy. Wow. Yeah. All right, what do you think the future is with all of this and where we go from here?
I think it's the future of surgery. I think the robots will get better and better, and surgeons will get better and better using the robotic assisted surgery, and I think the benefits are great for patients moving forward.
Intermountain is so wonderful, and all of the doctors, thank you for taking time out of your busy day and to Intermountain to set all of this up. All right, I want to try it again before you take it out of here, all right? I know you have to get off to surgeries right now. Thank you.
Thanks.
And thank you to Intermountain Health for sponsoring this interview. Still ahead on the show, add some more fruit to your diet. We are showing you a creative way with cherries for a good barbecue sauce recipe. And a new perspective on adoption. We are sharing a birth mother's point of view. GTU is back right after the break.